Good evening, everyone. Today is March 2nd. It's evening time, a little bit after 7. And I seen an article, but it's about something that Mike Bloomberg, he is one of the presidential candidates for the upcoming presidential election this year. Mike Bloomberg was talking about um, healthcare. Healthcare and for seniors that have chronic diseases. And we should honor our elders, grandparents. We love our grandparents, aunts and uncles, and people that just have that type of position in our lives. And for us to have or to be in a country with a vast amount of wealth here, we should be able to at least, as a country, take care of our elderly. They came before us, they paved the way for us. And I believe there should be something other than just Social Security to help our seniors be taken care of. Without them, we wouldn't be here. Those of us in this generation, those that are older than me, and those that are after me. I think that our elders need to be looked after. And as far as in healthcare, just care for the elderly, that needs to be looked more into and taken more seriously, because as you all probably know, there's a lot of incidents that have taken place in these nursing homes, these elderly care centers, places like those. It's a lot of just the wrong people taking care of our loved ones. And I think that we really need to examine this more. And that should be one of the big things that come up during the election. Well, this time, find out what these presidential candidates, what are their ideas or plans, actual plans that they want to put in action, as far as for healthcare for seniors. My parents aren't real old, but they're not that young. They're middle-aged in their 60s. So, those things matter to me. Their care is very important to me, and their well-being is very important to me. I know those of you out there, you have parents that mean a lot to you, and you want to make sure that they're okay and that their health is intact. That's on our part as children to help them as much as we can, but having health care is good. And I know there's a lot that goes in with that, as far as with taxes and that being used for it. With so much wealth, why are we having all these money issues in America when there's so much wealth out there, or that comes into America, that circulates in America? What's the problem, and how can we solve it? I mean, there's plenty of hospitals. There's a lot of nurses, even though it's in demand for nurses, but there's still quite a lot of nurses that are out there working. If we took care of our health, it'd be less people. Hospitals wouldn't be as full, wouldn't have so many people sick. And even into your older or golden years, it could be even better. Even if a person is up in age, their health can be better if we can get the right food and intake, the right or organic or natural foods in our bodies, in our systems. There's a number of older people, they get around really well, but it starts with our eating habits. That's a big thing. We have to, eating and our health care goes hand in hand. It just has to, because there's a lot of people that are out there sick with cancer just everywhere. And, there's got to be something to that. I believe that, collectively we could come up with something. Not having certain groups and companies in the way of changing that and making it better for our seniors That's the opposition. And then this presidential race, we need somebody should be up there that takes this into consideration, and this is a priority. I think personally, I hope that, you know, that's addressed during this election, and that we can come up with something, or something is, a plan is put in action that will keep healthcare going for our elders. I want my parents to be here as long as possible. I know you all do too out there. And we just have to come together as a large nationwide community to deal with this, I believe, and change it and come up with great solutions. But what's your solution? You can list that down there in the comments. I'll reply and we can have a conversation. All right. Talk to you later.